Very good morning. Respected Dr. Ashley, respected dignitaries, friends and families, it is indeed my pleasure and honor to be here on this great day. I was listening to Doctor and I was thinking that what will I speak, because a lot of medical terminology is what we must do.
Please move the mic up.
Can you hear me better?
Yeah.
So thank you. So while I was listening to the doctor speech about how do we prevent the diseases on, especially the kidney, I was wondering, being working software, what will I speak about my knowledge in this area. Then I thought we do at work a lot of stuff about how to prevent employee health diseases and what we do at the organization in terms of various preventive measures. One of the key things that we have noticed is that the health habits, because all of us are expected to work around the clock, because not just India alone, we have clients across the world. So the health habits, or how we actually behave ourselves, the food habits, etc., is very different compared to other individuals, and we felt that it's important we change ourselves in terms of how do we take care of our health itself. In that context, what I've noticed that the country is actually expanding or developing, and our living standards are getting better. That, in fact, actually adding maybe other cause where the food habits are going the negative manner. Most of us, including my kids, go through or taking a lot of food that are actually have a high salt intake and also unhealthy food, because as a childhood onwards, actually kids are actually used to taking high salt and eventually become irreversible in their life standard. So what I've learned today is that we must reduce the salt intake, we must do a healthy life by doing a lot of exercise. At work, while we have a lot of programs to take care of once events or the diseases happen, we don't do too much of awareness programs. I think we must take pledge to increase awareness by having a lot of programs, and I think I will definitely leverage Sapiens Foundation in helping us in this process. What Doctor's Foundation have done for the industry or for the entire country in terms of increasing awareness is phenomenal. I think all of us must make that a habit in our life and ensure that we are able to take forward in our life and better life forward. To give an example, I myself is a living donor for liver transplant. My own daughter, when she went through, when she was 8 months, a liver transplant, and of course it was not because of unhealthy habits, because it was inevitable. When she was 49th day, she was diagnosed with biliary atresia. The process that we went through was Kasai immediately in 2 days of diagnosis. But that did not help her. Within 8 months, we have to do a transplant. And of course, like any other parent, go through a big process where who will be the donor and what process and so on, right? Of course, 10 years ago, she is now 10 years old. She is in 5th standard. 10 years ago in Chennai, actually the transplant process was not available, or maybe it was there, but it was not that promising, and so we had to go to Delhi, find a doctor, do the process, and we were assuming that point in time was that it's a simple procedure, go through the process and then come out of it, right? We have a normal life. But the process was so complicated that the transplant process was like a liver transplant is much more complicated compared to kidney process. We had to go through about 18 hours of procedure for myself and my daughter, and the process was not over, right? Where she had multiple other issues. She lives a normal life today, but what I want to stress that all of us must work towards avoiding, if possible, right? Because a lot of diseases actually that we get through kidney or others are done because of food habits and other things that we don't do exercise and so on, which I think is important to prevent these diseases if possible. And thereby, the moment you get into the fatal stage and where we have to go through a transplant, the taking care of the situation is much more complex compared to our imagination, because most of us think that this medical has advanced, there are treatment, there is technology available for us to have better life forward. But once you are in the stage, doctor talked about 1 kilogram, a mechanical kidney that you can carry on, so it's not easy like to take it forward, right? So the most important thing for us to avoid that we do not get in the situation. So I'm very glad here that I'm talking about how we can prevent those situations, and how he has been teaching us about prevention is the best cure that we can have for any disease that may come up in your life. So I want to summarize saying that, take a pledge by myself, reduce, in fact, my home, my wife keeps saying that we take a lot of salt, we must reduce intake. I usually, because of, like I said, the habit is developed that take high salt, thereby don't listen to her, right? You have a salt shaker and start consuming more, which I think we must prevent it, and I think I should listen to her much more often. And of course, my kids take lesser salt because of her precautions measures that they take at home. But I travel a lot where, again, the salt shakers are all over on the food tables and so on. I think I learned that I should keep it aside going forward, right? So definitely that is a lesson, and of course all of us together here, listen to the doctor, his foundation, what he's doing for our country, which is extremely important. I think what I would say that in my DC or development center, to the entire employees, I will communicate this what I've learned today. And of course, I invite doctor and team to come one day to our campus and talk to our employees, talk about some of these things that we can prevent going forward, how we can prevent the diseases. I wish all the very best, and thank you once again for inviting me for this event here. Thank you very much.